For the latest, we're now joined by the Executive Director of the National Institute of Communicable Diseases here in South Africa, Professor Adrian Puren. Thanks so much indeed. It's been a while, but thank you for joining us.
Yes, it does.
This rise, I guess it was expected, and what we're monitoring is the level and whether we've seen a complete decoupling in terms of hospitalizations and deaths.
Yes, I think that still needs to develop as we go along, but for the moment at least, we're certainly seeing something similar to what we saw with the earlier resurgence, and that is a really rapid rise in cases thus far. When we look at the lag indicators such as hospitalizations and deaths, that looks very different again. So perhaps we will see something similar to what we saw previously, and that's not too unexpected given that the cause for this resurgence, or part of the cause of this resurgence, is really related to the fact that there are sublineages of Omicron. So there are subtle changes, in particular immune evasion, that is thought to play a significant role with regard to the fact that because of this immune evasion, we're certainly seeing an increase in cases. So previous protection antibody responses certainly has waned from what we can gather from at least one or two of the publications that have come out, and therefore we will definitely see that happening. However, the thought is that there will not be a dramatic change with regard to so-called T-cell immunity, and therefore severity of disease, therefore hospitalizations and death should remain uncoupled. But this we need to just observe very carefully as this unfolds.
You know, when I look around me, I get a sense that people think COVID-19 is over. And I see this number, 9,000 cases in the last 24 hours. At some point, that was a cause of alarm. Why isn't it so alarming at the moment, or seemingly doesn't sound as alarming, and yet it's a huge number?
It is a huge number. But I think the focus, although the focus is on the numbers, really, I think the focus has really changed in terms of specifically looking at hospitalizations and deaths as being a key outcome in terms of monitoring that. It's not to say that we should not be monitoring the trends, but again, as I think we've always said, there are these difficulties around understanding, the testing patterns. And so we may well be underestimating the actual numbers, but we're certainly seeing those increases. But I think the way our focus really has changed to specific outcomes, and that is the severity of the disease as reflected by hospitalizations, oxygen capacity, and mortality.
How do we explain that we haven't reached the targets that we wanted in terms of immunization? In fact, we really are quite short of that, and yet we're not seeing the hospitalizations, mortality rates concomitant to the numbers of infections.
Yeah, so I think initially it really centered around some of the variants that were in circulation, that in fact you had high degrees of transmissibility, for example, with Delta, but as well as severity of infections as well. And I think what has changed, at least with Omicron, is the fact that we have a highly transmissible variant. However, the fact is that we've had natural exposures, as well as some degree of vaccination, leading to at least T-cell responses remaining relatively intact. And so again, when you look at some of the evidence, and again, we still need to ensure that we can link the vaccine status to specific outcomes, is that the evidence shows at least that it's likely that people who are unvaccinated are really ending up in our hospitals. So I think it's because, in essence, because we have T-cell responses that are really protective, that we're seeing this disjunction or uncoupling, that we're having this sharp rise in cases, but not the severe outcomes that we've seen in previous variants, such as the Delta variant.
In previous conversations, we heard that if we don't immunize, the chances of variants is a little bit higher than if we do immunize. So are we perhaps, I don't know, perhaps sort of walking around with a false sense of security, because the more we don't immunize, we could see a variant that's a game changer coming through in the near future?
Yes, that is still the possibility. So I think, yeah, you're quite right. We should not be nonchalant about what's actually happening. That we've seen by chance again a variant that certainly has uncoupled cases from severe outcomes. It is possible, not necessarily happening in South Africa, although variants have certainly arisen in South Africa, or we've certainly spotted that fairly early on. It is possible that there may come along a variant that will behave very differently to Omicron. I mean, the idea that transmissibility is not an important indicator of the development or evolution of this virus is, again, to mistake what's actually happening. So I think we really need to still keep a sharp focus on this. And therefore, coming back to your point, I think it's still really critical to ensure that people are vaccinated. I think the challenges seem to be manifold in terms of why people are not being vaccinated. Again, there is that fatigue, I suppose, as some people use it. I'm not sure if that is the right word. In terms of convincing, I think, a large proportion, especially those who are vulnerable, to be vaccinated, but also to deal with those individuals who really do not have or have a philosophical, religious view about vaccination. So I think it's multiple things that we have to target, unfortunately, but these have obviously become a bit more harder to achieve. I'm sure you've seen some of the campaigns to address at least the younger generations. But again, the focus should really be also on the older generations where the outcomes are much more poorer in terms of comorbidities and age.
So the Africa Diseases Control talks about, of the 37,000 cases that have been reported in the last week or so, 93% are coming from Southern Africa. What is peculiar to this region, or is it that we're just better at testing and reporting?
I think some of it has to do, with testing and reporting. It has to do about, who presents for testing. Is it accessible? Is it available? And certainly in South Africa, at least, I think to a very large extent, testing is widely available. However, that does not mean that those who are ill necessarily present. And so it's really difficult. I don't have a sense about other countries with regard to the availability of testing. I know that there's been a very big drive to use antigen testing because of the costs involved, and of course, antigen tests create a greater sense of accessibility. It's very interesting to see the report on mortality, for example, that in fact, I think about 41 African countries have no good data to report mortality. So yes, I think there's a matter or concern around the availability of data. Of course, the demographics are also very different as well. Possibly in South Africa, we have probably an older, more established population versus some of the African countries, but that still does not explain all that we're currently are seeing.
Do you think we need to be more circumspect, a bit more careful about the relaxations that we've seen? Should we be pulling back some of those relaxations in terms of, we've seen already that the health department sort of quickly track back in terms of classroom wearing masks. Should other things be brought back in a little bit more?
I think that it depends on what we're looking at specifically. I think sometimes we have focus on specific things such as, hand sanitization, the temperature checks and so forth. Some of these things really don't contribute. I think it's what contributes to control. So, for example, again, mask wearing in specific settings, numbers of people in specific settings, ventilation. These, I think, are the key things that are really critical and play an important role. And again, looking at age groups and age distribution, and therefore the wearing of masks, again, I think there may be subtleties or nuances, but you're quite right. There may be, under certain circumstances, one may be reconsidering, the wearing of masks, even if that's on the outside. But again, as you know, we've really struggled, I think, very often to try and ensure that there's adherence or a high degree of compliance with these particular regulations, even though I think it's supposed to be mandatory. I think we have had challenges around that, but you're quite right. And one can certainly bring it to the fore to try and really to manage and control. But I think it has really been quite a challenge to do that.
All right. I mean, it's been a long journey. We've learned a lot over time. How much do we know about the times that we're living in and where we are with the pandemic?
I think it's very difficult. I think many of us would like to think that we're reaching that point of, as you said, living with the virus endemicity and so forth. But I think we just still need to be cautious. I think there's a lot to learn. This virus has been very dramatic. I think we expected, I suspect many of us, to see another independent variant arising. But no, we have a sublineage of the Omicron virus that is now currently in circulation worldwide. In the United States, it's a different sublineage causing marked numbers of cases as well as hospitalizations, whereas in South Africa, that's a sublineage, BA4 and BA5. So again, there are many surprising things, and I think that we really need to keep our guard up and investigate as best possible. And of course, looking at vaccines as well, I think we can't think that boosters is going to be the way out. Possibly. I think it certainly plays an important role. But again, looking at more universal type approaches to vaccination may also be a critical component as we move towards the future.
I know it's hard to compare countries, territories, partly because age groups are different, and we know that sometimes even racial profiles may play effect. But I just wonder, China, what can we learn from them? Because they're struggling with a resurgence in recent weeks.
Absolutely. So China, as you know, similar to, I suppose, New Zealand and Australia, followed that zero policy. And in fact, they had a severe lockdown. In fact, it's interesting that some people do argue for severe lockdowns in control, but then it needs to be balanced with the severity and some of the adverse events, such as that of the economy. But a consequence of that lockdown is the fact that, in fact, the virus is still entered and we're able to cause high degrees of transmission. But I think the challenge in China as well, which is different we have our own challenges here with regard to vaccination, is really their focus in terms of the vaccine campaign. So I think they did not focus on older age groups and so forth. So I think there were poorer outcomes in that particular age group. So that again, I think re-emphasizes the need that you need a broad vaccine strategy, that you cannot focus on specific age categories and exclude others, because the consequences of that is what we're currently are seeing in China. So despite the fact that they had a severe zero tolerance lockdown, it still affected them to a fair extent, and had a marked effect on their economy as well.
All right. Professor Puren, perhaps a final thought. What are you most worried about in terms of COVID-19 and where we can go? As the NICD, you're sitting there and it's your job to try and monitor and make sense of things. What's keeping you awake at night at the moment?
Well, I think it's really around, have we understood what's actually happening with this particular virus, and do we know what's going to happen with this particular variant? And therefore, are we ready? In other words, the concerns again are around hospital readiness, in terms of bed capacity, oxygen capacity, and so forth. And those are key. But I think the other part to this, and I know it's been talked about, but maybe not as much in South Africa as elsewhere, is really the sequelae or the outcome, the so-called long COVID or post-COVID sequelae or syndromes. That too we have to deal with. And I think it's not just that we've really been focusing quite heavily on COVID over the last 2 years, and with good reason. But I think we need to rebalance and refocus, I think, on other communicable diseases, and in fact also non-communicable diseases, in order that we have an effective approach rather than a silo approach to just focusing on COVID to the detriment of other key diseases. We're entering the winter season. Influenza has always been traditional, and that has changed. But again, do we expect to see influenza coming about? We've certainly been seeing sporadic cases, so that's of concern. But could that blow up into having a dual pandemic or dual outbreak in South Africa? And respiratory syncytial virus again. We've had the periods where we've had low seasons of RSV, but again, that's resulted in immune gaps. And again, could that critically affect what we're currently seeing in South Africa? So those are multiple things. I'm sorry, I probably went off on a tangent, but I hope you understand that it's a complex problem.
I hope you are getting some sleep if all of those things are on your tray at the moment. Prof, it's always good talking to you. Thank you so much.
Appreciate the opportunity.
Good night.
Thank you.